Good afternoon, everyone, and welcome to another all-colleague COVID-19 update. We really appreciate you joining us and taking the time to do that. And we also thank those of you who will be watching this after we record this for taking the time to do it. This is our opportunity to keep you up to date with what we know as things change quickly, and your opportunity to ask us questions so we can make sure we're delivering the type of information that you find very, very useful. The thank you today is to Renee Miller, one of our patient access representatives at the Brainerd Clinic. And I have to tell you that I am so jealous of people that have artistic talent like this. She painted on the window there together while apart, along with all kinds of hearts. And I'm sure that cheers everyone up. And I love the little silhouette of someone blowing that across there. So Renee, thank you so much for doing that. I'm sure it's appreciated by your colleagues, appreciated by our patients, and certainly appreciated those of us here at Essentia. Our agenda today, we have some good news and an update on elective surgeries here in Minnesota. Dr. Bill Heegard is going to give us some key learnings from them restarting surgeries and other procedures in Fargo. Our modeling team is going to give us a predictive modeling update, and then we have some time towards the end for Kari Russell to answer some of your questions on masks. So why don't we get started? So we had good news this afternoon at 2 o'clock. The governor made an announcement. And to put this into framework, at the start of the pandemic, in the middle of March, to keep staff and patients safe, we really needed to preserve our personal protective equipment, or PPE supplies. And so to help us do that and to make sure that the best way to do that was to not do things that were possibly could be delayed, Governor Tim Walz ordered a non-emergent surgeries and procedures ban in the state of Minnesota through an executive order. But as those of us that work in healthcare know, as the weeks have passed, surgeries once considered elective are becoming time sensitive. Just because it's elective and can be scheduled and doesn't need to be done right now, doesn't mean that it's surgery that doesn't need to be done. And those of us that are healthcare providers have been feeling this, our patients have been feeling this, and the governor's office and the Minnesota Department of Health have been feeling this as well. So today at 2 o'clock, Governor Walz signed Executive Order 2051, allowing the resumption of elective surgeries and procedures in Minnesota. The current executive order will continue to be in effect until midnight this coming Sunday. So Monday we can start to do those procedures again. All healthcare providers are required to have a plan in place and a written plan to ensure conservation of PPE along with patient and staff safety. The governor says it strikes the right balance. It's responding to our patients whose quality of life has been impacted while still preparing for the surge, promoting safety, and allowing us to be ready for that surge. My colleagues and I, through the Minnesota Department of Health and through others, actually sent in a thing to a proposal to the Minnesota Department of Health. They worked on that, sent that out at the end of last week and received over 1,000 comments on that, but then turned it around really quickly over the weekend. We are so appreciative of the governor listening to our patients and the healthcare providers, along with the Department of Health, literally working through the weekend to be able to do that. So as we do this, our colleagues in Fargo are a little bit ahead of us. And what I'd like Bill Heegard to do, our West Market president, and Bill has only been with us for a month, which in COVID time, I'm sure it feels like a year, but I would like Bill to share what they've done to move forward with this so we can learn from that here in Minnesota and benefit from their experience. So Bill, I'll turn it over to you.
Thank you, Dr. Herman. I want to just share with you a few thoughts, and that's a wonderful segue with the announcement from Governor Walz into what we're doing. The first time that we really discussed this, I remember it very well, was about 3 weeks ago, and it occurred during our incident command meeting that we have each day at 7:30 in the morning. And to be able to imagine a different way of doing things, you need a spark. And the spark really came in a discussion where Dr. Herman asked us, we all know that we're not going to be getting through COVID quickly. We had hoped we would, but it wasn't going to happen. And he asked us the question, what does it look like to live in a COVID environment in the long term? That really sparked a lot of conversations within the incident command, and then later within our group of physicians and other leaders, and we began drafting a plan to slowly resume more procedures and surgeries. We did that by what we always do. We go to the literature, we looked at the data that existed there, we went to our professional organizations and looked and got guidance from those organizations. Minnesota Hospital Association, Dr. Herman mentioned, had drafted some language and had been shared with the governor's office, MDH. We were able to look at some of that. And we also looked at other organizations like Mayo. And the guiding principle that we had was we knew we had to do it safely, and we had to do it responsibly, and we had to do it in accordance with the regulations of each state. And North Dakota had a little different regulations than in Minnesota at that time. Next slide, please. This picture I just want to highlight, and Dr. Herman did a nice review of, when the Governor Walz had stopped had the executive order to stop all elective procedures. And that was roughly around March 15. And if you look at this, you can see this had a dramatic impact. And that was the purpose of it. This comes from the West, and it was a couple of weeks ago. But you can see that we are down, and we've been consistently down between 60 and 70% in our surgeries. We're really only doing life-threatening or emergent surgeries. So, and the reason for that was we needed to be ready to be able to manage a surge or a plateau or an increase of cases that were COVID-19. Remember, we were seeing the images from Washington State and then New York and New Orleans. They were really overwhelming and sad and horrific in many ways. And we realized we needed to pause and get ready. In addition, we needed to be able to ensure that we had adequate PPE. And thanks to all of you that work, we are now. And then we had to increase our capacity of testing. Next slide, please. So when would we be comfortable to be able to move ahead and start doing some time-sensitive surgeries and even moving into the realm of elective surgery? Well, that was the point when we could say that we had conserved PPE, that we were recycling and reusing our PPE appropriately based on the science, and that we had an adequate supply chain that allowed us to be confident about our deliveries of PPE. That step 2 was setting up screening stations that all of you have seen in place for staff, patients, and visitors to ensure that our staff and our patients were safe. We rolled out a universal masking policy, and that started on May 1st. And that's to ensure that we have safety for all that walk through our doors. And last, we greatly increased our testing capability. And that not only was at the state level or through Mayo in Minnesota, but also we rolled out rapid tests on the day of surgery. And we first started off in Duluth, and then Brainerd, and then Fargo, and now we've expanded it to almost all of our acute facilities have that capability. Next slide, please. So with that, and we also set up a kind of a protocol where we have a 72-hour before we have a COVID test, then we have 72 hours of a quarantine or isolation of the patient, and that's strict. And then we recheck them when they come in. We ensure that they don't have any of the symptoms that is established by the CDC, the most common symptoms and signs for COVID. And if that's negative, and if there is any concern, we do another rapid test, and then we move forward with the surgery of the procedure. I want to thank a number of people. I've listed the individuals that were very involved in this, but I also want to make sure that people understand that this was a team effort, and there are lots of other people, not only the physicians there, Nicole Christensen, Carrie Carlson, lots of people on our end and in the East, in Brainerd as well, that ensured that this was safe and there was conversations. We needed to have conversations up and down with all of our leaders and be able to have the dialogue necessary that people could feel confident that we could move ahead safely. And last, we sent out communication with our colleagues in a memo form, and then in addition, communicated through our incident command structure and cascaded down. Next Slide, please. Our guiding principles are ones that I think everyone can agree on. We wanted to use a thoughtful, cautious, and I would say phased approach, and I really want to emphasize that. In the beginning, we just wanted to do and have procedures that allowed a minimal impact on hospital bed capacity and the minimal use of PPE. As we started to get more comfortable with this, we'll consider other surgeries. But importantly, we decided we wouldn't do total joint surgeries in phase one. We would avoid those surgeries that may require multiple days in the hospital. As I talked to you, we had a protocol that we followed, and we didn't view this at all from a competitive standpoint. We viewed it from the lens that we wanted to do the best that we could for the community, because now we're into 6 weeks and it was time, and people were starting to move from elective to time sensitive and needing these procedures. Next slide, please. So I like to say that we want to crawl, walk, and run. We realized and have acknowledged that we're going to have starts and stops on this. A pandemic is unpredictable sometimes, and we have to be ready to change our plan and be comfortable with that. I want to give a shout out the modeling team, and I've said this and I really mean it. It's really impressive how well integrated your modeling and analytic and informatics team is into operations. And that was extremely helpful, because you may be aware that we're having a little increase of cases in the West, and to be able to see how that modeling was going and ensuring that we'll do this safely and have time for and be able to slow down if we need to. This graph shows the surgical volume by classification. You can really see that we really started to crawl initially. Now, tomorrow will be our biggest procedural day, where we have 26, which we would list as time sensitive or elective surgeries. Next slide, please. So the key learnings, safety, and I think you know that from the mission and the values of Essentia, that safety and being careful and thoughtful, both staff and as well as our patients and our community, guided us. You want to vet the plans very thoroughly with your leaders and give them time to talk and express their concerns, and you want to take it slow. Next slide, please. So as we have gone through this, and I would assume everyone will experience this as you roll this out, you know, it isn't surprising that patients are at times hesitant. We have had a good response, but a certain number of people have been hesitant about coming into the hospital, not sure it was safe. So we have made extra efforts to call them, explain things, our procedures, and how we're keeping everyone safe. And we'll ask you that you do the same. And the keeping you safe is really an idea that Dr. Herman mentioned, and just how we're going to communicate out to the community that our priority is keeping you and the community and our staff safe. So thank you very much.
Bill, thank you to you and your team across Essentia for doing this difficult work, and thank you for being so thoughtful and deliberate in going forward. We're all hoping that we can, as we gain more experience with this and as we learn more about the things that we can do, that we can start to accelerate this. There's a lot of people out there that are waiting for our services. Some are very uncomfortable and many are anxious. And the sooner we can get them to the spot where they need to be, the better off all of us are. Bill gave a great call out for our predictive modeling team, and each week we like to bring them forward again to show everyone what we've learned in the past 7 days. So with that, I'll turn it over to Dr. Sarah Manny and her team. Thanks to the team for joining us again today.
Great, thank you, Dr. Herman. It's been a very busy week. We've seen some changes at the stay-at-home order. We've had increased testing in both North Dakota and Minnesota, and all of these factors are changing the model. So we're going to meet again tonight with the Minnesota CMAO group to go over the changes that we'll be observing in the model going forward. Right now, our focus with our team is looking at localization and trends. We're looking for hotspots and how we can provide that information to operations and leaders to help as we move forward in this pandemic. Coming up later this week too, we will have an e-learning that I will go into more detail on Friday, and we're excited to share that with you. So I'd like to turn it over to Elena, who's going to share the projections dashboard.
Yeah, thanks, Dr. Maney. Let me just pull up my screen here. Okay. So I don't have any significant visual changes to share with this if you were here last week, but I will just share sort of what we've been seeing in the past week across our markets. So as of yesterday, we were at about 1,237 confirmed cases to date in our markets. And you can see the breakdown by each of our markets across the top. What I want to draw your attention to is the two graphs on the bottom here. So here we're looking on the bottom left at projected cases, or sorry, confirmed cases compared to projected cases. And so the black line here is the confirmed cases, and then the blue lines are projected cases based on static doubling rates. And so again, the doubling rate is the number of days it takes to double your number of cases. Larger doubling rate is a good thing, indicating potentially slower growth. And we can see here across all of our markets, we're kind of below this 10-day doubling rate line. And if we look over on the bar graph on the right, this is the 7-day average doubling rate. And we can see over the past week that doubling rate across all of our markets has increased. So that's a good thing to watch. The other thing that we have been keeping our eye on is the number of new cases per day. And that's a bit more variable across our markets. So we can see here in all of our markets combined, that's sort of hovered, anywhere from the 30s to the 70s. And I'll just quickly share in the East market, this has hovered anywhere between 3 and 9 number of new cases each day in our East market. Whereas if I flip over to the West market here, our Central has like 1 or 2 a day. Simply because it's kind of a small number of counties that we're looking at. In the West market, we can see a slightly larger number of new cases per day. So we've been keeping our eye on that. And one thing that we are trying to distinguish as well and do a little bit more research on is how the number of, the increased testing is having an impact on these cases, or the number of new cases being reported, an effect of simply testing more people, or is there something else going on? So that's something that we are actively working on. And with that, I can turn it over to Niall to talk a little bit more about the MHA model and the changes that we've seen over there.
Thank you very much, Elena. So I'll share my screen here. So work like Elena's is really valuable, both immediately to our leadership, but also to the Minnesota Hospital Association, which again meets every Tuesday in order to discuss the latest findings, both within the Minnesota Hospital Association, different systems, the 9 big health systems in Minnesota, but also the most recent and up-to-date literature that has come out regarding the spread of COVID in our community and across the world. So last week, when we met on Tuesday, there were a few changes that we made to the model. The first was a slight change in the doubling period, reflecting a slight increase in the doubling period for the whole state of Minnesota. We moved from around 15 to a little over 16 days. And that had a minor effect on the model. We also had that sunsetting, remember, on May 4th, meaning we had that 16-day doubling period only till May 4th, expecting that there was going to be some kind of change in the stay-at-home order, and it would be useful to think about what might happen with that change. The other thing we made an update is based on some recent literature on the asymptomatic rate. So that's, what proportion of individuals who contract the virus don't have any symptoms at all. And originally we had around 30%, and we've moved that up based on some very good studies in Italy to almost 43%. Now you'll hear a bunch of those numbers sort of bandied about in the news, and we're always trying to review that literature and really pick the best, both in terms of having the kinds of numbers you need to make some good conclusions, but also paying attention to the methodology to make sure, for instance, we're not lumping together people who will develop symptoms with those who have no symptoms at all. So those were a few of the changes that we made. I think the important thing, again, as we use this Minnesota Hospital Association model, is we're really using it directionally. We're really paying attention to whether or not we will be crossing these different surge levels. As you see here, we have our med surge level highlighted, and then we have a number of different scenarios indicated by the shaded bars. And paying attention to whether or not we are going to hit these different surge levels for our facilities, either at the market level or even down to the location level. And in most of the scenarios we run at the moment, we are encountering a change in the type of surge we could expect with this initial wave, sort of regardless of what market and whether we're looking at med surge, ICU, or ICU with vent. So with all of the changes that are happening socially and politically, obviously we'll be revisiting all of these assumptions again tonight and making some new forecasts and models as we go forward. Thank you. I'll stop sharing my screen.
Great. Thank you so much, Niall and Elena. Thanks, Dr. Herman.
Thank you. And I'll go back to sharing my screen here. And we have one more slide for you here.
Yeah, so we've developed, along with OL&D and the brilliance of Colleen Brown, a new e-learning about predictive modeling. And so we'll be showcasing that on Friday and then getting that out to everybody to take a look at.
So thank you very, very much. I'm excited for that too. I've seen several previews of that, and I think that'll be helpful for all of us to take a look at. And when someone asks us a question, sometimes it's hard to explain, but this is done so nicely and so well. I think people could go through it several times and pick up something each time they go through it. So I want to thank the whole modeling team, as well as the people that put together the education for this. And eager to hear what happens tonight at your meeting to see where we are and a better idea of where we're going. But thank you so much. We have some time today to go have some additional questions. And since these questions were about masks and other infection prevention thoughts, I've asked Carrie Russell to join us here this afternoon. And Carrie, thanks so much for joining us, and I'll hop forward. So. All right. Here is a picture of someone using a nylon stocking, and the question was, can we use this to increase our protection for others and even for ourselves? So with that, I'll turn it over to you.
All right, thank you so much, Dr. Herman. So this question was sent to us by one of our colleagues in Detroit Lakes, and this picture shows somebody using the nylon stocking over a cloth mask. I just wanted to point out for staff who have any sort of direct patient-facing role, they would be wearing a procedure mask or an N95 mask, and the filtration on all of those masks is already very excellent. There would be absolutely no need whatsoever to add a nylon stocking over the top of any of our PPE level masks. There are a couple of concerns with using the nylon stocking over a cloth mask if you happen to be one of our staff that are wearing the cloth or the homemade masks. I have some concerns with being able to take off the mask and put it back on if you need to take a break during the day, get a drink, eat your lunch, whatever. It just would be very difficult to take that nylon off, put it back on knowing which surface of the nylon was over the front of your mask. So you would just have to use really a lot of care if you were going to try to do that, but really is not needed whatsoever if you have a PPE level mask. Next slide, please.
Okay. Yeah. So another great question, would it be possible for Essentia to provide material for making masks? I've seen other cities create kits ready to be picked up for those who can sew and include all the materials needed to make a homemade mask.
All right, another great question. So we do have some kits available, mask kits in the Duluth area. There are still over 500 kits available, and each kit has the material and elastic to make 10 masks with each kit, and those are available at the Duluth donation site at the Miller Hill Mall. There are no plans at this time, at least that we're aware of, to make additional kits. So when they run out, at least right now, there are no plans to restock. So those can be picked up again at that Duluth donation site at the Miller Hill Mall and then dropped back off at that donation site. Or alternately, they can be dropped off in Superior at VIP Pizza. And then also wanted to note that employees sewing the masks can also log their time as volunteer hours. And currently there are no kits available for people to make masks in either the Central or West markets.
Carrie, if there was sufficient interest, could we, courier some of the masks over to Brainerd Lakes or to Fargo if someone had a group that said, I have found, several of my friends that are willing to do this. So I know we have couriers that go back and forth. Could that be a possibility?
Yeah, I definitely think that's a possibility. I think we could just coordinate that through our volunteer services leaders in those other markets.
Oh, super. So thank you very much. So if anybody has an interest, here is the live update questions at Essentia Health. So if you do have an interest and you have a group, please send us an email to that, and we'll see what we can do to get these mask kits to other places as well. Also, I want to encourage anyone and everyone, if you have a question, to submit it to this email address. This is our best guide to provide the best information to you. We never know exactly how long these are going to take, and it looks like we're about 4 minutes early. So what I'm going to do is I'm going to turn 4 minutes back to everyone. I want you to take the 4 minutes and to breathe and think good thoughts and decompress as either you end your shift or start your shift. Again, I want to thank everyone for the hard work that you're putting in each and every day. I want to thank my colleagues for joining me on these to provide information to you and to the entire organization. It's important that we stay in touch, and it's important that we stay informed. So please enjoy the rest of the evening, and we look forward to seeing you back again for another one of these Friday, May 8th at noon. Thanks very much, everybody.